Before patient contact, don appropriate PPE. For demonstration purposes, I'm going to wash my hands and don gloves. Hello, my name is Sirat. I'm one of the doctors. Could I confirm your name and date of birth, please?
Yeah, it's Tom Davidson, 23rd of the 1st, 1992.
Nice to meet you, Tom. Tom, today I need to examine your eyes. This involves me looking at each eye and then shining a light in each eye. Is that okay with you?
Yes.
Okay, great. To start off, if you look straight ahead, I'm just going to look at your eyes. I'm assessing size, shape and symmetry. Okay, now I'm going to move on to shining the light into your eyes. Before you use the ophthalmoscope, make sure it is set up for use. Switch the ophthalmoscope on. Ensure it is set on 0 and ensure you are on a clear white light and not a coloured light. The ophthalmoscope is now ready for use. Stand at an arm's length away from the patient to assess the fundus reflex. Next, move closer to the patient to identify a blood vessel through the pupil. Is it alright if I place my hand on your shoulder?
Yeah.
Once you've identified a blood vessel, move medially to identify the optic disc. Assess the colour, cup and contour. Next, assess the 4 vascular arcades by following each one. After this, examine the peripheries by looking up, down, left and right. Finally, ask the patient to look directly at the light to assess the macula. Could you look straight at the light, Tom? Thank you. That's the end of the examination. Make sure you examine each eye.